On this ITP Awareness Month, to spread awareness on immune thrombocytopenia, we have one of the eminent hematologists, Dr. Aniket Mohite, consultant hematologist and BMT physician practicing at Jahangir Hospital, Sassoon Road, and Nova Solitaire Care, Karadi, Pune. Thank you so much, doctor, for sparing your valuable time. What is immune thrombocytopenia?
So, ITP is a rare blood disorder. It is an acquired disorder of the platelets where it can occur from any age group, from the childhood till the age of 80s or 90 years of age. It's basically because your own immunity is destroying your own platelets. So, as soon as the platelets are produced from the bone marrow, the antibodies which are produced in excess from your own body as a response to maybe viral infections or bacterial infections which the body has just been exposed to. The excess of these antibodies cause destruction of your own platelets which are formed in the body. So even if your production happening from inside or your platelets from outside, the rise in the platelet is not achieved. So that is what is called as immune thrombocytopenia or immune thrombocytopenic purpura as it was called in the past. Commonly, we divide them for easy understanding whether this is acute or chronic. Acute means which is just recently in the last couple of months or 3 months as per the definition. And chronic is something which the patient has persistent low platelet count after as long as a year or beyond. Now, the common problems or common things which we need to rule out is ITP is a diagnosis of exclusion. So we need to rule out viral infections, we need to rule out drugs which cause thrombocytopenia, and n number of other things, or even leukemias or bone marrow primary problems. And only after exclusion of all this, you come to a diagnosis of ITP. So it is a pretty common disease per se in the general scenario as a common hematological disorder, but this is something which is rare that as a general community person you would come across.
What are its signs and symptoms, and how to detect ITP?
Like what we discussed in the previous, ITP is basically a cause where your platelets are going to be low. Now, platelets are your cells which help in clotting. So whenever you have a deficiency of that or less number of that, it will present as a bleeding problem, which can be as small as tiny bluish purple patches on the skin, which could be present on anywhere in the body. It's typically be on the pressure points on the hands, forearms, or in the legs. It can also present with gum bleeding or GI bleeding, where you may have blood in vomitus or blood in stools. Or in females, it can present with menorrhagia or excess menstrual cycle bleeding or frequent or heavy menstruation which goes on for a few days or sometimes a week or more. So it is basically going to present with some of the other bleeding manifestation. Now, the life-threatening ones are those where there is bleeding in the brain or there is bleeding which is occurring from the GI tract, which is just ongoing. And because the GI tract is quite a big juncture at low platelet count, it cannot do any intervention. So those are some things which could be life-threatening and needs an urgent medical attention. But the rest, which are smaller enough, can be easily tackled. But the cause of this is like idiopathic, like it is just because of your own immune system, like any arthritis or rheumatological disorder where your own body is destroying your own joints, like in rheumatoid arthritis. This is just an excess antibody response from your own body, which is destroying your own cells, not able to distinguish between what is self and non-self. So that barrier or the boundary of your what is your own and what is not your own, the body, because of post-infection, the body loses that control and sometimes leads to its destruction of your own cells, which can happen in the joints in arthritis, and similar can happen in against the platelets in your eye tissues.
So, third question would be including 3 myths and facts. Myth 1: platelets can be increased with intake of platelet boosting nutriment.
Yeah. So commonly with any patient which I have incurred with, they would always come up with the common myth that can I take dragon fruit, kiwi, or cow colostrum or sheep colostrum or any of these, which are there's a myth in the common scenario in our society that taking this can increase the platelets. Now, to some extent, it does help in some viral illnesses or post-viral illnesses like dengue fever, but not in others. In immune thrombocytopenia or whenever you have a bone marrow problem and your platelets are low, none of these food habits or none of the changes, modifications of your diet are going to help to increase your platelet count. We actually put them only on restriction for spicy food so that they don't have gastric ulcers or GI bleeding. But other than that, none of these dietary modifications of fruits or any particular food product is going to help you increase your platelet.
Second myth, ITP always causes severe symptoms.
Now, as like any disease per se, ITP is a huge spectrum. So it is not just one severe disease like what I discussed in the first question. It can present variably with just bluish purple patches, or in some females it can just present with heavy menstrual cycle bleeding. So it has a vast spectrum which can be as simple as just some spots onto the skin or just some bleeding from the gums after brushing the teeth, to sometimes can be life-threatening as an spontaneous bleeding into the brain where it is the patient is found unconscious or has just a trauma or a fall banging into the washroom on the head, or has tripped into the washroom and found to be unconscious. So the life-threatening ones are those that are GI bleeding or in the CNS bleeding or the intracranial bleeding. But apart from that, it can just present with blood in urine, blood in vomit, black color stools, or fresh blood in stools, which sometimes can be easily manageable and it is easily treated. I'll just add on the line. So here, what we need to understand is we are not treating the platelet numbers. We are treating the symptoms of the patient. So we are not worried about whether the patient's platelet count is 5,000, 9,000, 10,000, or 50,000. Whether the patient is having bleeding symptoms or not is what we always go with, and not with the platelet count. Your platelet counts are going to just fluctuate like stock market. So I give any of my patients the example of stock market. Today it has gone up, tomorrow it has gone down. So the way you check your stock market on your mobiles on a day-to-day basis, we don't keep checking your platelet count on day-to-day basis. So you just check or be watchful for your bleeding symptoms and just report whenever you have bleeding symptoms.
Third myth, there is no effective treatment for ITP.
Yeah, this is a pretty wrong myth. There are ample amount of treatments which are present for ITPs. So there are at least 50 to 20 different drugs. And the only surgical option that we have, which is as a last resort, is blood pump. So basically in ITP, you have your platelet destructions because of antibodies. So increasing production by thrombopoietin analogs like L-thrombopag or Romi, which are oral or injectable drugs, to something as simple as steroids or IV immunoglobulins or anti-D, which can be used in emergency situations like pregnancy or delivery or whenever you have an intracranial bleed. So whenever there is life-threatening, you use this quick-acting drugs. But apart from that, you have a lot of immunomodulators like cyclosporin, mycophenolate mofetil, azaran, rituximab, steroids, and plenty of these in the armamentarium, which can help or improve the suppressing or balancing the epigenetic. Apart from that, you have immunomodulators like danazol or dapsone, which are useful to prevent the platelet destruction and slightly able to target the RBCs and causing us a slightest drop in the hemoglobin and helping to improve the platelet count. Now, each drug has a different time to act and it has a different duration of wait period. Sometimes it can be as quick as 24 hours like IV immunoglobulin, and to 3 to 7 days with steroids, to sometimes a couple of weeks to a month with various other drugs. So depending upon how is the urgency, we choose which drug is used. And when nothing works, sometimes we have to go to the surgical option of splenectomy, where all these platelets are being destroyed in the spleen. So the organ of destruction, and that is removed, can help in the improvement of platelets. So every patient, you cannot treat each patient with the same drug. This is one disease where we have to always give the individualized approach. Like someone working in the IT, we try to keep the platelet count of 30,000, whereas the hard worker or laborer who is working in the construction sites where they are more prone for injuries and at the risk of bleeding in the brain, we try to keep the platelet count of 50,000 and above. Similarly, whenever there is a minor surgery, a similar thing of 30 or 50,000 can work, whereas in a pregnancy or a delivery, we try to keep the platelet count of 80,000 to a lakh. But depending upon what is the task, what is the target that the patient is going to go through, we try to negotiate or try to titrate the platelet count to keep it as safest as possible and give a near normal lifespan. These, like what I discussed before, is like stock market. Sometimes they are going to go up by themselves, sometimes they're going to go down. Typically, when they have viral infections or flu-like illnesses, there will be expected drop or more destruction of the platelets. So we just have to try to balance the production and the destruction by medications, by some spontaneous improvement of their health profiles, and allow them to do a healthy normal lifespan. Some exercises or smaller things which would be allowed is doing jogging, walking, and yogas and all these things, but no shirsasanas or no heavy weight lifting, so that not prone for injuries. They can go onto the treadmills, do some push-ups or pull-ups, but they should be basically adventure free, so that they don't go out into the society, have a road traffic accident after risking travel onto the highways. And because if they bleed into the brain, they are at risk of quick fatal episode within a few minutes or a couple of minutes per se. So you have to always be like balancing what would be the risk benefit ratio. Similarly, you have to balance what are the issues which I can happen, which I should do or I shouldn't do, and then take an informed decision. So this is what we would discuss with the patient, as this is what it can do and this is what you should avoid risking or at keeping you away from injuries at work, at home, and wherever you are in the society.
What are the do's and don'ts of ITP?
The do's would be having a healthy, balanced diet. So there's no food product specific which can help to increase the platelet count. So just a normal basic diet, less of spicy food, less of green chilies. Even if you have added it for the taste per se, just keep it out of your plate while you eat, so that it doesn't go into your stomach and cause gastritis, because that can cause GI bleeding. So brisk exercises, walking, jogging, treadmill, yogas and all these would be allowed, because you need to keep your body in shape. The more you become overweight, because if you need steroids and any of these medications, there are risk of gaining weight, there are risk of muscle weaknesses. So you need to keep your flexibility bang on mark. You need to have regular checkups. So if you are on treatment, maybe a weekly initial blood test is what you would need. And then gradually we will increase the follow-up up to once in 15 days, then once in a month, and then gradually once in 3 months. Once you achieve a steady state, sometimes you may be off medications. Some of them would maybe around 30% of the ITPs who are chronic and are drug dependent. They need to continue on some of the other medication to just keep the platelet at a steady level. A small fluctuations, 5,000-10,000 here or there, are acceptable, but as long as the bleeding is at bay, we are good to go. Now the don'ts is adventure sports or anything like bungee jumping, any adventure risk riding or road rashing onto the roads, working where you are at a risk of head injury without an helmet, and all those things are some things which we would definitely not ask them to do. And anything from the addictions per se, alcohol is known to cause thrombocytopenia, or any hepatotoxic drug which can further worsen the platelet production, or as well as increase the spleen size and increase the destruction, is what we need to avoid from. So this is not something which is a contagious disease or a spreadable disease per se. So you just need to have a healthy normal life, limit as much as adventures as you can, and just continue take a healthy lifestyle. minute, you can be back to work. There's no need of any stringent work dynamics that you need to follow, any office transfer. Even those who are doing a heavy job can still go back to their jobs as long as the platelets are beyond a particular threshold. Thank you.